you very much, Prof. C, and thank you for the opportunity for me to become a moderator today. So without further ado, our second topic today is on the artificial intelligence in prediction of breast cancer. So as we reiterate what Prof. Ng has mentioned in the last few slides on the risk factors of breast cancer. So how do we actually apply this into the AI and made it into a prediction model or prediction tool for assisting our breast surgeons in the future? So back to the term AI, I think a lot of people has this misconception that AI means robot, okay, and it stops at the level of robot, which is not true. Okay, so we have no other more suitable speaker than the one who works at the groundwork. So we have today a very distinguished speaker from the Multimedia University, Associate Professor Dr. Wong Lai Kwan, and she's with us online. Hi, morning, Prof. Wong. Hi, and she's currently an Associate Professor at the Faculty of Computing and Informatics in Multimedia University. And she received her PhD degree in computing from National University of Singapore. And she's also Deputy Director of Center of Lifelong Learning and Innovative Education, LEARN, Learn. And she also is the chair for the Center of Visual Computing. Previously, she served as the Deputy Dean for Research and Innovation for Faculty of Computing and Informatics. And for her dedication to teaching, she was awarded Excellent Teaching Award by Multimedia University. Okay, so without further ado, the floor is yours, Prof. Wong.
Okay, good morning, everyone. Good morning. Thanks, Dr. Teo, for the introduction. Just to confirm, you all can see my screen?
Yes.
Okay, great. Okay, so today I just would like to share with you the use of AI, or rather artificial intelligence, in the prediction of breast cancer, all right, using mammogram. First, let me share with you a video.
Accurmetrics, our advanced algorithms and medical imaging tools, are useful for the radiologist in evaluating mammograms with greater speed and accuracy. When Curemetrics AI scans a woman's mammogram, it's actually doing that with the intelligence gathered from millions of mammogram images from women around the world. It adds an extra layer of precision, helping to flag suspicious cases and reduce reading time for more streamlined workflow, helping radiologists focus on abnormalities that could be missed with outdated technology. And then it scores them, providing the doctor additional intelligence, potentially eliminating unnecessary biopsies, which can increase costs and patient anxiety. It can also assess breast tissue density and automatically provide a density classification. And AI can even help detect a woman's risk of heart disease from the same mammogram and score her risk level so she can monitor her health progress over time.
At the end of the day, our doctors want AI technology, and our patients deserve the advantages it brings to everyone.
Artificial intelligence is powering so much in my life today. When it comes to my healthcare, I want that extra layer of confidence knowing that AI is supporting my doctors.
Curemetrics AI-based technology gives doctors more control than ever, resulting in faster and more accurate readings. Because their peace of mind
is my peace of mind.
Okay, so what you have seen just now is actually the first, all right, AI mammography system that is actually approved by FDA. And subsequently now there are many more, all right, this kind of AI system from mammography that has been approved, and here are some of them. So next, I would like to give you some background knowledge or context on what is actually the technology behind this AI mammography. And then we are going to move on to look into what can AI do for mammography. And finally, we look at how well does it work for AI in mammography and what are the technical and clinical challenges. Okay, so let's look at what is the technology behind AI mammography. So the technology behind it is basically, although we call it AI, but very specifically the current very advanced technology behind most of this system is actually based on the foundation of artificial neural network, and more specifically deep learning, which is a specific type of neural network. So sometimes we tend to link all this together. So basically AI is a more general or bigger umbrella. Then inside AI, we have machine learning and artificial neural network, or NN here, is one type of machine learning, and deep learning, which is now the very advanced and so-called most effective technology behind image processing, is actually deep learning. And specifically for AI in mammography, a lot of them are using what we call CNN, that is convolutional neural network. Now, don't worry about this term. I'm just going to give you a very high level information on what this is, so that you can have an idea of how and why it works. So basically, as you could see here, this is, all right, the human brain. We humans are very smart. We can recognize the apple almost instantly. But how can the computer do that? Now, in order to allow the computer to do that, what the scientist does, the computer scientist does, is that they came out with something called neural network. That is a network that consists of many neurons that mimics the neuron in the human brain. So it's a bio-inspired kind of information processing paradigm, all right, inspired by the biological nervous system of our brain, and it can then recognize apple. So more specifically, like I briefly mentioned just now, our brain consists of a lot of neurons. This is just one example of the neuron, all right? It contains 10 to the power of probably 10 or more neurons. And that's what makes, all right, our brain so powerful. So what the information system or computer system trying to mimic is, it tries to come up with a structure, all right, that mimics exactly, for example, the component of the soma, all right, there's the body cell of the neuron, and the dendrites, there's a connection, all right, into an information processing paradigm or network that looks something like this, and it can then learn, all right, from the data given to it. Now, how does it learn? It learns from the data given to it. So it's just like the data is like our experience. So for human, when we are a child, we don't know a lot of things, but as we grow up, we learn, and then we accumulate knowledge. And from this experience, that knowledge that we gain over time, then we become, all right, better and better in doing certain tasks. So similarly, for a neural network like this, it learns based on data. The more data it has, the more experience it can learn, and it can actually be so-called more smart, all right, like human. So the key thing here, actually three things. Apart from the architecture here, it needs a lot of computation power, and it needs a lot of data. So it's the technology, including the hardware, and, all right, the data as well. Without the data, it couldn't do much. That's why actually this neural network technology has been in fact introduced, all right, in the early 80s and 90s, but it didn't become very popular because we don't have the data at that time, and it could not work very well. But recently, all right, the data is now available, all right, in large amount, all right, in any way, and therefore it supports this technology. Now, how does it actually work? So we have a network. So basically, for example, for the task of object classification, we can give the objects and label it, and then we pass this whole large data set. It could be millions of images or hundreds of thousands of images, and then we let this neural network learn. Now, what is basically this neural network? Is basically a lot of processing, which is like a neuron that learn different features of the image. All right. So given an image, it will learn, and it can tell you that it's a cat, it's a dog, and so on. And even more advanced, it can do object detection. That means you can see like a box here. That means it can actually detect where the object is. And even more advanced, you can see that it can actually detect or segment out the object, all right, relatively accurately, like the human, the elephant, all right, the vehicles here. Now, why can it work so well and how it works? Now, you know that just now I mentioned that the neural network actually simulates the architecture of our brain. All right, it's bio-inspired. So our brain also learns, all right, in some kind of way. So normally to recognize an object, we will look at the features of the object and then we are able to recognize. Like for example, this is actually some of the visualization we obtain from a neural network like this. And very interestingly, all right, there are many layers here that you can see. The earlier layers here will learn the low-level features. The middle layer will learn the middle layer features, and the later layers will learn the higher level features. Which, for example, for face recognition, all right, this is what it learns. So it will first learn the ages, all right, the color, and so on. And then it will move on to learn parts of the object like the eyes, the jaw, the nose. And then it put everything together and then it can recognize the face. All right. So you can see if we visualize, we can actually see how the network learns, all right, during the process of the training. And what's the impact of deep learning in computer vision? Okay, so deep learning first started in 2012 actually, and there was a ImageNet that is one of the first data set created by a research team in Stanford to actually, because at that time they realized the unreasonable effectiveness of the data, and they know that in order for neural network to learn well, they need a lot of data. So the Stanford collected a very large data set that is still used until now. It's actually millions of images with hundreds of labels, all right, cats, dogs, and so on. Sorry, thousands of labels, and subsequently they have more. All right, but at that point in time, it's thousands of labels. That means they have millions of images, and they're trying to recognize thousands of images. And the performance, all right, you could see the blue one is traditional image processing or computer vision technique. The orange is actually the deep learning method. All right, so the first deep learning method actually came out about a decade ago in 2012, and you can see is when it was first out, the performance already, this is the error rate in the classification, it actually surpasses all the traditional computer vision techniques. And in the subsequent year, you could see in contrast, in 2012, you only have one deep learning technique, but in 2013, you only have one traditional computer vision technique, and all become deep learning. And subsequently, all right, in the competition, all right, in this challenge, people only use deep learning technique. And you could see the accuracy, it has actually improved, all right, from error rate that was around 20% to error rate about 3 to 4%. And now it's probably less. And that is actually classifying 1,000 objects in, all right, millions of images. Now, how is the performance in object detection? Like you said just now, it can detect the object, find the object, where is it, not just telling whether this image is a cat or dog. All right, it can tell where is it. The performance and impact of deep learning for this is even more. You could see that before 2012, the performance, all right, the mean average precision is only about 40%. But with the introduce, all right, sync of the deep CNN or convolutional neural network, you can see the performance actually have been increased tremendously. And now it's actually more than 80%. So that is a very significant improvement. All right, and why it works? Because it's actually trying to mimic how our brain learn from experience. Now, what can AI mammography do? So we have seen what, all right, is the technology behind it and how well it works for natural images. In fact, it works very well for natural images, and it is now used a lot in the industry. All right, in autonomous vehicle driving, in video surveillance, and so on. But what we are interested in is that how and what can AI mammography do? So it can do cancer diagnosis. All right, for example, given a mammogram image, all right, passing through a network, it can actually learn whether it is a cancer or a non-cancerous network. All right, so for more details, you can later refer, all right, to this. There's a very latest state-of-the-art review paper on the various technique in this. In addition to that, it can also do cancer detection, just like object detection. So it can localize where are the potential cancer cells. All right, and on top of it, it can possibly actually segment, all right, out the region as well, just like what you see it did for object detection. And another thing, another area that some researchers are looking into is actually the risk prediction. So I think just now Prof talked about the breast density and it's possible correlation to the potential of developing breast cancer in the future. So this researcher, all right, Yaya and her team, or Lemon and his team, actually did a very interesting experiments, all right, and they came out with a method to improve, all right, breast cancer. Now, let's look at this, for example, experiment. So you could see two axes here, all right, the top axis. So this is actually the different type of, all right, so this is a different type of the classification of the density. So these are the accurately or correctly classified. All right, that means fatty being classified as, okay, one of these is actually radiologists and one of these is actually AI. Now, which is which? So in this case, in the middle, that means all these are classification where radiologists and AI agree on. All right, whereas on the other axis is actually where the AI and the radiologist doesn't agree. Okay, so now, do you think the x-axis or the y-axis is AI or radiologist? Anyone want to give it a guess? So interestingly, all right, the x-axis here, that all right, is actually the AI. All right, this axis is actually the AI, and this is actually the radiologist. So from here, all right, what they actually observe is that before that, so they actually observe that for certain tasks, the AI can actually do better than radiologists in some area, all right, because it is more consistent. All right, so you can see that from our eyes, or maybe the radiologist will knows better. So the classification here has heterogeneous is actually more accurate than on this axis. Some of these may not actually be heterogeneous. So this shows that for certain tasks, all right, that is looking at the lower level features, in fact, AI can have more consistency than the radiologist. And this is also a study where they found that there's actually a wide variation in human interpretation. All right. They did a study, and this is a graph they plot, where they found that 40% of US certified breast imaging radiologists perform outside recommended ranges for acceptable false positive rates. All right, this is a study to show in 2017. So don't get me wrong, all right, radiologists out there, I'm not saying that you're not doing a good job, but this is just that for certain very tedious tasks, the AI could help. All right, but how about in diagnosis and in other aspects? So that's what we are going to learn on. All right, we are going to look into. So this is actually what they get, the results, all right, the same paper. So they have a neural network and they learn, all right, and they find that the neural network, all right, can actually achieve about 97% agreement with an expert radiologist. All right. So that is actually quite interesting, and they actually you have done this experiment on more than 40K mammograms. So how well AI mammography works? We know that some area it may work well, but in reality, how well does it work? Is it good for clinical now? So let's look at some of the very recent study in just this last 2 years. All right. In fact, this was last year. So there's this paper on a brief perspective paper on the Lancet. So you could see that, all right, they actually tested an AI system. So they find that 34 out of 36 AI system evaluated were less accurate than a single radiologist in terms of diagnosis. All right, and all are less accurate than the consensus of 2 or more radiologists. Okay, so this is when they evaluate the system by just using the system without the assistance of the radiologist. So in other words, we can say that AI system at this point is still not suitable to be used independently. All right, radiologists in this case, in terms of diagnosis, still performs better. All right, if you're interested, you can look into more detail in the paper. And then in another studies, they look into combining the strengths. So just now we know that individually, independently, we know AI won't work well. Now, what if they work together with radiologists? So there's this study, all right, also on Lancet Digit Health, all right, published this year, April 2022. So they actually look into combining the strengths of radiologists and AI for breast cancer screening. And they actually did a retrospective data. All right, they actually did the study on a retrospective data set consisting of over 1 million images. And what are the findings? So they try a few pathways. So this is the existing pathway. So you have a double reading. So you need 2 radiologists to read. So they are proposing 2 alternative pathway that include the AI in the loop and then study its performance. So then they introduce this is a standalone pathway where they actually replace one of the radiologists with an AI. All right, with some they applied the AI model, the deep learning model, and they have some threshold setting, and then they have the AI to make the decision, and then it comes to a consensus, all right, decision together with a radiologist. And the result is they find that the AI achieved the sensitivity of 84.2 and the specificity of 89.5 on internal test data. And for external test data, it achieved a sensitivity of 84.6 and a specificity of 91.3. All right, but this is less accurate than the average unrated radiologist. All right, that means compare A and B, actually A might do better than B. Okay, now they propose a new workflow. So this is actually the new workflow they propose. So what they do is that they first pass the mammogram to the AI to evaluate if it's confidence in its predictive ability. So the AI will actually divide it into 3 types. Confidence, so that means it's very sure that these are normal, or very sure they are cancerous, or there are some that they are not very sure, either not confident or no prediction. So for the confidence, then, all right, this they do not need the radiologist to go through, but for the not confident one, they will go through what we call a decision referral process. So studies refer to radiologists without indicating those with a cancer prediction. So the radiologist will do an independent kind of process on it. All right, they actually compute the BRATs, and then based on this value, all right, then it will then decide whether it's normal or there's a safety net. And then if there's a safety net, that means warning display to highlight AI confidence cancer predictions. Then it will go through another, all right, the radiologist again, then it will actually come to a consensus, right? So using this new proposed that they call decision referral approach, all right, they find that it actually improved, all right, a point radiology sensitivity by 2.6%. That means compared to just using radiologists, it can improve the performance by 2.6%, all right, and specificity by 1%, all right, corresponding to the triaging performance at 63% on external data set and, all right, AUROC of 0.982. So this shows that it can actually surpass the radiologist's performance with this new workflow. And some interesting opinion on this. So in conclusion, what it says is that if doctor and AI works together, it was actually 2.6% better at detecting breast cancer than a doctor working alone. And it raised a few alarms. All right, it accomplished this while actually automatically setting aside scans is classified as confidence normal, which amounted to 63% of the mammograms. So this actually is an intense streamlining that could actually help to reduce the radiologist's workload, because you can see at this point, there's no, for those who are classified, those mammograms that are classified as confidence, it doesn't require the involvement of radiologists. All right, and yet it can actually give a 2.6% performance better. And that same AI also produce more accurate result in the hands of a radiologist when, all right, than it does when operating solo. And this is a researcher, Curtis Landgraf, from director of Stanford Center for AI in Medicine and Imaging. He said, we often say that AI will not replace radiologists, and this study does not change that, but the proposed AI-driven process, which is this, all right, actually processed nearly 3/4 of the screening studies didn't need to be reviewed by a radiologist while improving accuracy overall. So that is actually groundbreaking. So in conclusion, all right, radiologists and AI system yield significant differences in breast cancer screenings, revealing the potential value of using both human and AI methods in making medical diagnosis. And every patient in this study will continue to, all right, but this is actually the patients in the study, they will actually still be interpreted by the radiologist if it doesn't fall under the confidence level. And that shows that it improved the performance. All right, so finally, what are the technical and clinical challenges? All right, we know for clinical adoption, it's not as simple as you use it for, let's say, video surveillance. All right, you have a lot of processes to go through. Now, let's look at what are the technical and clinical challenges. So some of the technical consideration and challenges is generalizability of the data. We know the deep learning, it learns well because it learns from a lot of data, and all right, it's like the experience that we learn. So the data is one of the key to the accuracy. First, it needs to be very diverse. So we can't train for, even I think a couple of years ago, the Stanford, medical imaging team, they did a AI system that can detect lung cancer very accurately in the lab, but they review that when they bring it down to another hospital down the road and it doesn't work because of different equipments and so on. So that is one of the challenge, how well it can generalize for different equipments, all right, different lighting conditions and so on. And that's why the data need to be very diverse. So that is one of the technical challenge which can be solved. There are some, a lot of research that looks into this. Transparency and explainability. So I believe just now the explanation give you some explanation of why it works, all right? But actually now there are also a lot of tools and researchers start to look into having better visualization that can help, all right, radiologists or doctors to understand what the AI is actually looking at and what is it that it used for its prediction. And I believe if this improve, then the confidence of radiologists and or doctors in AI in medical imaging will certainly improve as well. These are two of the key challenges. And of course, others is the validation of the model, the performance requirement, the standardized testing and comparison, which I believe is very important in the clinical settings. And of course, the workflow and integration. So we have the system now, but how do we integrate into the existing workflow of the clinical settings? Now without which it might not be very useful or very effective. And then, of course, that involves challenges in changes in clinical reporting as well. And then what are the clinical consideration and challenges? Of course, performance, I'm sure radiologists and doctors and how well can it perform? Can it perform better than human? So from the study just now, it shows that it still needs a radiologist, and it's best at this time that it work together with radiologists. And of course, workflow and integration again. I think in radiology, they have this QMS or quality control kind of processes, enhancing quality using the inspection program. Patient acceptance is also very important. If the patient don't trust, then they do not want to go for, this kind of AI prediction as well. And of course, the medical and legal aspect, that's something I believe, some of the medical and law people actually looking into this aspect as well. Okay, so with that, so in conclusion, what we could see is that there's a potential in AI, to help improve the performance of diagnosis or even prognosis in mammography, but there are, still quite a few challenges that need to be overcome. And at this point in time, it's best that, the radiologists can actually work with the AI system, to probably get good performance as well as to reduce, the workload of the radiologist. Okay, so with that, I end my talk for today. And Dr. Teo, I pass it back to you.
Thank you very much, Prof. Wong, for the very, very eye-opening lecture today. So I've learned a lot from you and understand more about AI. And a point of relief there is for all the doctors to know that we are not going to be replaced by AI in the future. Okay, so we complement each other. So I think due to time constraint, I'm just going to open the floor to one burning question, perhaps, if anyone has any question.
Okay. So I have a question to Prof. Ng and Dr. Wong. I would like to ask, do you think we can have a special tool for our breast cancer detection in the coming future? If yes, what is the model that do you think best to suit in research, clinical practice, and with humanity?
Prof. C, that is a soul-searching question. Scientists are still working, debating on that. So ideally, we want to have a system that can have early detection, accurate diagnosis, and also will have accurate prediction in that. So first, we need to have, as I mentioned in my talk, the various imaging modalities. So there's no single technique. We need a multiple, might be mammogram combined with ultrasound and MR. And with the data collected, a huge amount of data, the images, we still haven't extracted the information. We're applying much improved AI techniques. And this is all integrated system, right, from the bedside, screening detection, right, to the decision making. So there is a complete system that will be work in progress. Because right now, the manufacturer just concentrate on improving the hardware, right, and the software people on the AI. So it'd be good to see in the future we integrate the whole system, even right down to the grassroots level, where the education awareness of the people will be encouraged until and also the meaningful collaboration amongst the radiologists, the surgeons, the physicians, and the others as well.
We have a question. We have a question from the floor, At this point, is AI being practiced in hospital for breast cancer? Yeah, I think Prof. Ng, what do you think? Should we or are we?
Right now, there are a couple of obstacles that prohibit is being implemented. When we say use, meaning right now, right, the radiologists write a report in AI, the surgeons perform surgery. What AI people think is evil. There's no longer a human, right? The AI will interpret the mammogram and make the report and sign off. That's not possible now because of various medical legal issues and ethical issues as well. Right? So one challenge is who will be responsible. Let's say the AI system signed off, okay, that is a benign lesion. It turns out to be malignant. So there'll be legal issues, who is responsible, who will be liable, the hospital, the AI developer, the manufacturer, and so on. So these are some of the issues that are still being discussed and debated until such time. The many hospitals around, they use AI as some computer-aided system to assist in that, to improve on that.
Okay. What about Prof. Wong? What do you think?
Yeah, since the question is actually related to the hospital, I think I was just chatting with Prof yesterday. So we know that in Malaysia they are not so much implemented. But I'm aware that in overseas they have started to implement. But of course, I think if you are looking into the integrated system, may not yet, but they have started, using it. Like for example, the study just now, the latest one, it was actually done by a group of Germans. So they actually tested that on many. If I recall, it was about 1/4 of the hospitals in German. So they're actually testing on that. So and in US as well, all right, some hospitals are already using it. But as to how far is integrated, I think that is still something that looks into. Probably they're more using it, for still under clinical testing and trial, all right, and integration is still something to be looked into.
Yeah, I would think most of them are still under testing and clinical trial because there's a lot of issue that like just Prof. Ng told us. And from here, we also have some question about a lot of time our patients was put off from the not on the accuracy of the result, but more on the pain when they have mammogram done and mammogram examination. So the humanity part is also another part that we are looking at when we want to get a new tools or to make a future tools that is suitable for our patient and which is accurate, as well as everybody won't have, I mean, the least uncomfortable that we can have for our patient as well. And I don't think this is a near future possible, Prof. Is it?
Many attempts to improve the compression. Compression is needed to produce an image of higher contrast so that they can reveal the location, the nature of the lesion. Right? A lesion, I mean, could be a malignant or a benign lesion. So somehow we still need some compression, improving the compression plate, the contour, also the experience of the radiographers helps quite a bit. I would say, I mean, it's the pain have come down quite a lot. It's sort of discomfort, slightly uncomfortable. There are various techniques. People have tried this. A couple of hospitals, they let the patient do the compression themselves, and you control, right? You press the button, so you compress the breast until such time you can't stand it anymore until your threshold can stop, and that is pretty good, right? So it's sort of patient-centric or patient-empowered mammography. Perhaps UMMC could try that as well.
That is a very good news for our patient in future, Prof. Yeah, with the concern of time, I would like to end today's Faculty of Medicine Breakfast webinar. We hope we will have a better tools to assist our patient and to help us to detect our breast cancer early. Early detection save lives. With this, I would like to thank Professor Emeritus Dr. Kwan Hoong, Associate Professor Dr. Wong Lai Kwan from Multimedia University, and my partner Dr. Teo. Till we see again, happy Wednesday to all of you. Thank you.